Okay, so I'm Laura Vandenborre, and I'm a Canadian certified pedorthist here at Maple Shores. And what that means is I focus on lower body ailments, and I use custom orthotics and orthopedic footwear to treat them. So low back pain isn't really something that I kind of focus on, but it does come up a lot. A lot of people are struggling with low back pain. And how I kind of take that into account with an orthotic is we look at kind of a couple things. So first thing would be, we're always just looking at general alignment from the ground up. So looking and seeing what's happening at your foot and ankle and how that might be kind of relaying up into the hips and pelvis and low back structures. So whether if you're overpronating and you're not getting any shock absorption that way, or if you're not what we call resupinating, where that arch is coming back up in the second part of your gait phase, we can actually kind of create some of that shock absorption with a custom orthotic. So that's one way that I would kind of look at assessing and looking at low back pain. Another thing that comes up a lot, I shouldn't say a lot, but it does come up, is leg length differences. So what I mean by that is if one limb is actually structurally shorter than the other, then we can look at actually building that up from with the orthotic or with an actual lift built into the shoe. So that's kind of where I take a look at things. I do refer for low back pain a lot of the time, but structurally, that's how I would assess things. So, Zach, why don't you take over next?
Sure, yeah, I just wanted to take my time, talk a little bit about the role of the hip in low back pain. So I'm just going to share I can't share my screen. Never mind. Yeah, talking about the role of psoas in particular. It's a long muscle that connects your low back to your hip. And living in 2022, a lot of us spend a lot of time in flexion. Our shoulders are falling forward, our hips are closed in, and then that muscle just learns to be short, and it stays short even when you stand up and walk around. So it's always good to look at a client when they come in and test the hips as well, seeing if there's any restriction in the front of the hip that's leading to that low back pain. These compensations that everyone's carrying around that don't always jump out at us, they present as low back pain when in reality it's coming from the hip. So I always kind of take that one step back, trying to look at the role of the hip into the low back and the mid back and low back, trying to approach it from both sides, and then including massage therapy and acupuncture and cupping and many other tools to kind of help treat things as they come along. I'll just pass it over in the square to Tony.
All right. So one thing that we look from, I'm Tony Kaake, and I'm an osteopath massage therapist here at Maple Shores. And one thing we also take in consideration is looking at it from your organs. So sometimes, for example, people can have bowel issues, constipation, menstrual cycles, or even like bladder infections. It'll show up as back pain. So a lot of times we're chasing after some stuff that's actually coming from inside the body. So something I'm really stressing on my patients these days is really trying to get them to move their torso, move around, I describe it as the pasta inside us is our organs. And if your pasta is fresh and it's hydrated, it's always on movement and it's free. But the problem is, as Zach touched in on, we're sitting so much now that our pasta is drying up and it's becoming stuck. And when it gets stuck, then we become more prone to these injuries because we're just not able to move. So even if people are walking on a regular basis, the problem is you're still not doing that twisting, turning motion. So people, if they get into yoga, Tai Chi, these things all help keep the organs free, but sometimes it takes someone to go in and actually manually release some of these organs to help the back pain. That's my cue, and I'll pass it on to Adam to wrap it up.
All right, how's it going, guys? I'm Adam Blackadder, I'm a manual osteopath here at Maple Shores. So pretty much as an osteopath, we take a collective look at the body, right? So everything is interrelated and the body's a dynamic unit of function. So nothing ever gets injured alone, or nothing gets injured isolated, I should say rather. So like how Laura talked about the foot, as osteopaths, we might look at the foot as well, seeing or going through each joint of the foot, seeing how that might relate up to the back. Zach mentioned the hip. So at the end of the day too, if no joint's doing, or if a joint's not doing what it's meant to be doing, then that force is going to get transmitted to another area, which is not necessarily supposed to carry that burden. So by taking a collective look, we're just kind of eliminating these areas and having a full body assessment to see where some of the pain might be coming from. So Like Tony said, it could also be coming from the organs. But to touch on another area that we haven't mentioned is even the neck. So in today's society, a lot of like people are getting like text neck or very short chest pec line. So by having that short chest and pec line, that's going to cause you to almost protract your neck or stick your chin out. And to compensate for that, you might be kind of arching or doing an anterior pelvic tilt, kind of compressing those, compressing the lower back, for lack of a better word right now. So as it relates as well, so the neck and the lower back are both anterior curves, so they both bend in the same direction. So when there's compensation in one curve, you're going to see that compensation in another curve. So like that's why a lot of the time lower back pain actually comes in hand to hand with neck pain. I see a lot of patients come in, they're like, oh, lower back and neck. It's always typically those two curves that are like compensating back and forth and typically take the brunt of that aberrant tension, for lack of a better word. Yeah, so by doing a thorough assessment, kind of really seeing what's restricted, you can narrow in where that back pain could be coming from and get a more accurate diagnosis or structural diagnosis. So I hope that was clear and
the nice part is what hopefully we explained from all of us is that there's lots of different angles in which back pain can be coming from. And if you're not getting success with one practitioner, maybe it will take 2 or 3 other ones to kind of work as a team. So here at Maple Shores, that's something that we really strive on, is trying to work as a team, look at things from all different angles and pull it all together. So if you have any back pain, call Maple Shores. Hopefully we can help you. Have a great day.